Welcome to the Hank Cisco Show. Ladies and gentlemen, thank you so much for allowing us to come into your home, and we thank you for allowing us to come in. And I just have a couple of short announcements before I introduce my guests. I just want you to know that just for the last couple of weeks or so, a couple of things happened in my life. I turned 82 years of age, and then my wife and I, Dolores, celebrated our 50th anniversary, 50 years married. Oh man, I'm telling you, it's great. And I just had a couple things happen the other night. I have two of my close friends, Arminio Gambone and his wife Enzia, and Bill Mueller and Elaine Mueller. They took me to an Italian restaurant down Surprise in Philly. I guess it's Society Hill. It's a what's it?
Positano. Positano Coast.
Positano. Man, oh man, I thought I was in Italy.
That's a great restaurant.
Yeah, it's called the Coast because of the coast of the
Amalfi Coast.
Yeah. Oh, I'm telling you, it's beautiful. You know, it's not a commercial. I'm just saying it was just so wonderful. These two guys, and they picked up the check. Boy, I'm telling you, it was heavy. But and I'm a Manjun. I like to eat. You know, and it was just nice. So I just thank you that this is going on my 16th year on this TV show. So I'm there thankful to Norristown High School, John Doyle, and everybody, and the staff. The cameramen here, you know, have been so great. So it's allowed me to bring my guests in here. We talk about Norristown. We try to educate the people. And now you're getting a house visit, a doctor making a house visit right in your house. And we're going to talk about, he is Dr. Vincent Mascarello, who is Mascarella.
Mascarella.
With an A on the end, right?
Yes.
Okay. And you are I say foot doctor. You say what?
It's a podiatrist or a foot specialist.
A foot specialist, okay, you know. So I could never spell it, so I always say foot. I get easy to spell, you know. But now tell me something about yourself. Now you're a Norristown native, right?
I'm a local
Tell
boy.
me something about you, your family.
I was born and raised here in Norristown. I attended Holy Savior Elementary School.
Right.
Grew up in the East End in the Italian section on a little street called Diamond Avenue in Black
Diamond
Horse.
Avenue. That's a famous street.
Very famous street.
I think Vince Piazza and Mike Piazza, with the baseball player for the Mets. Danella,
Danella was
right, and Mike Grant, who was a former heavyweight contender.
Yes.
He lived on that street. So a lot of famous people, and it's only about a block long.
Small block off of Ridge Pike.
Right.
And after Holy Savior, I went to Bishop Kenrick High School.
Right.
And stayed
Who was
local.
the principal then? Father
LaHart.
Oh, Father LaHart.
Father LaHart was there, and we had, at that time we had a lot of priests, and the nuns were really teaching the entire school.
Yeah, yeah. But you went to Holy Savior. Were you on the safety patrol?
Yes, I was. That's where I first met you.
You were one of my safeties.
One of your safeties.
Police. I had charge of the safety patrol.
What
corner did you have?
I had Walnut and Moore Street.
Well, Walnut and Moore. Wow. Yeah, that was a heavy lot of turning traffic there.
A lot of traffic there. It was
Yeah.
good. I remember your shows coming out to the students every year, and you talked about safety.
Yeah,
and big thing was to be one of the safeties for you, and wear the yellow badge, and we even did that on the buses.
Yeah, never cross when the light is red. The light is red.
That's
and everybody would sing, you know. But okay, now so you went to high school, and then you went to college.
Yes,
right?
I stayed local. I went to Widener College out in Chester, Pennsylvania. I guess one of the call of fames at my time was that Billy White Shoes Johnson, the famous football player, was in my class.
Oh, okay.
He eventually played for the Houston Oilers.
Mm-hmm.
So then after that, I went to Temple University School of Podiatric Medicine.
Okay.
And I completed a residency. I trained inside Philadelphia. I did a surgical residency for 2 years at a hospital called Metropolitan Hospital. It was at 8th and Ray Street.
Oh, yeah.
Right
It's
across
a round building near the police.
Exactly. It's across
roundhouse.
street from the police department, the headquarters. And the funny thing about it, they closed the hospital, and they just refurbished it into luxury condominiums.
Oh, yeah?
Yes.
Is that a regular, just foot?
No, it was regular. It was
regular
a
hospital.
Hospital.
So now it's a condominium. Well, what are you going to do? You know, things keep changing. Maybe they'll move into Norristown. We're talking about a hospital moving out. Maybe they'll move in. You know, we'll talk about that. You know, I don't know. We can talk about that. We don't have no control over that.
No
right?
control at all.
No control.
Especially with healthcare.
But okay, now, so you took up feet.
Yes.
Feet and ankle.
Yes.
Right?
Yes.
Okay, you know you're my doctor, right?
Yes.
Last
This
week,
is my patient.
I had
a
ingrown toenail really bothered me. It ingrown. It grows this way.
You were hurting. You were in pain.
Yeah, I was going just clip it. You know, I didn't like get them needles. You know, but I would clip it, and you'd spray it a little bit and numb it, and it keep bothering me. So now I said, look, do what you got to
Take care
do.
of it, and we did it.
Wow,
And you feel good today, right? You feel okay?
Oh yeah, I can go now, no problem whatsoever. So this is live, okay? Now, you just involved with a new type of procedure.
Well,
okay?
Recently there's been some interest in a portion or a problem that occurs very, very commonly with heel pain. A lot of people get heel pain for a lot of different reasons.
Oh yeah.
And in the past, the only treatments were either painful injections at times, orthotics or arch supports, and when everything failed, we did surgery. A newer procedure has come out called shockwave therapy, where we do shockwave. We actually use shock waves, very similar.
That you got a little. Show me something about that. In other words, here's the heel part, right?
This is the heel.
Yeah, right.
And
where's the pain go?
Well, this is a little piece of tissue. It's not a bone, and it's not really a tendon. Some people even call it a ligament. It's called the plantar fascia. It attaches from the heel to the ball of the foot. Now, when people stand or step, it pulls. When you pull it a lot, it gets inflamed. It gets sore right here.
You mean like if you have something on the edge?
Now, when you step down and your arch goes down, it keeps pulling. So when you step down, it pulls, and if it keeps pulling over a period of time, it gets real swollen. It gets sore inside.
Oh, okay.
This is why one of the classic symptoms, as soon as someone wakes up in the morning, they put the foot down, they come in and tell me they can't walk. The first 1 or 2 steps are excruciating. They're so painful. That's almost classic in this type of condition.
Oh, okay.
It's seen in all age groups. Even people who are in sports, they can overuse this. It's more common in people who have flattened arches, people who are overweight, sometimes even people who have problems.
In other words, people with overweight, that's causing a problem, extra weight on
extra weight
joints.
Pulls this.
And your joints also, right?
And your joints also puts excessive pressure on the joints.
But now.
So in the past,
get rid of that pain for me.
Exactly. In the past, here's what we would do. We would either give you some medication or send you to physical therapy, tell you to stretch it and stretch it, put an arch support in your shoe. In severe case, we put a needle or an injection right around that area. We put some medicine there to numb it, and then we put in something like a steroid. Some people call it cortisone for that area.
Okay.
And the idea there is to bring down the inflammation. When the inflammation goes down, the pain goes away. It's usually successful.
But that's temporary.
Well, it's usually successful a good percentage of the time, but about 20% of the people, it just doesn't help. And in the past, we reverted to surgery. And surgery was to actually go in and cut that tissue, and if it's present, remove a spur.
The tissue that grew in there.
The tissue that grew and is inflamed, and many times people got a spur right there, a bone spur. And that's another common thing people would say. I got bone spurs in my heel.
Joe DiMaggio had one.
Exactly. The fact that ended his career.
Right.
Because years ago, the surgery for that was to open up the heel in the back, take all the tissue down, and once they did that to Joe DiMaggio, he couldn't play baseball anymore.
But if that procedure was around today, maybe he could have played a
little
longer.
Absolutely. Definitely would have had some more hits. Absolutely.
Right.
Now, this procedure is interesting because it really has been used in the past.
Where's the shock come in?
Well, the shock comes in, you have people with kidney stones. And people who had kidney stones used to go in a tank and they would shock wave and break up the kidney stones.
Oh, okay.
Same thing, same shock waves.
How about that?
This was really, it goes back, believe it or not, into World War II. In World War II, people were dying in submarines, even if the submarine wasn't hit by a torpedo. They were being killed inside the submarines by these shock waves from the depth charges.
Oh, yeah.
The waves came in.
You see that in the movies.
Exactly. And then the investigation and research has shown that these waves can be concentrated into a small beam. And that small beam then can be used at one spur
how about that?
So this is why we can break up kidney stones. So the idea is, well, let's do this on the heel. And the shock waves are imposed into the heel for 18 minutes, thousands of them, constantly.
Just bang. Yeah.
Bang. And that breaks up the scar tissue, it breaks up some of the inflammation, and really what it does is starts the whole thing healing, re-healing on its own. Wow, it's about 80% to 90% successful.
Okay. But it's just like you mentioned, and I read this article in the paper, we had it in the Times Herald, about this whole procedure, you know.
Yes, the Times Herald came out to the hospital over at Mercy Suburban where I was doing the procedure. At the hospital, they came in and observed it.
Right.
It's a great procedure for a couple reasons. One is that there is no incision, no cutting of the skin. It's really not invasive. There's no stitches involved. People walk out without a bandage. They can get the foot or ankle wet immediately. They can walk immediately. The other advantage is that there's no complications. Very little of any complications.
Right.
So it's a good alternative.
Right.
The only negative is that right now our insurance companies aren't always paying for it.
Hey, come on now.
We're
You know,
trying to change that, and more coming on board.
don't the insurance company want to keep us healthy or what? I mean, what's the
They,
scoop?
they do, but with new procedures, there's sometimes a time lag until they give it so many months.
Yeah, before they come up and say, yeah, it is a good thing.
Exactly. So there's a new code for it, and by next year it should be included by all.
In other
the
words,
insurances.
you have to pay for this out of your own pocket.
Some you do,
Some of it.
and some insurances will cover it.
Yeah. Well, why is that? That don't even make sense. I mean, you know, if
It's
proven.
It's proven,
it's
but
just like aspirins, it don't work on everybody.
it doesn't work on everybody. But the thing is that the insurance companies don't want to pay all this money. Sometimes the procedure will be given for everyone, and they're afraid that it's going to be overused.
Yeah.
Everybody comes in, they're going to use it. So they're a little cautious in it, but hopefully by next year that'll change.
Well, I think if people have pain, you know, just at least go get checked and find out
Absolutely.
if that can be done.
Well, here's the
why live with pain?
Well, here's the telltale signs, and most people will tell you. The one I mentioned earlier, they wake up in the morning, and that first step of the day is excruciating. As soon as they step out of bed,
Yeah.
and it eases up as they walk, but then if they sit, like we're sitting now, and they go to stand up again, they feel the pain again. So that recurrent pain is a classic sign of this condition called plantar fasciitis.
But how about cramps, like get cramps in around your feet or so when they tighten up? Does that have anything?
Cramps could be a lot of different things, not usually associated with this. It could be in a younger person. It could just be overuse. You know, the muscles are just tired and overused.
Athletes or something
Athletes,
like that.
et cetera. Could be poor blood circulation. Could also be sometimes loss of, we call electrolytes, things in the blood, potassium, and certain elements or chemicals in the blood that are deficient or we don't have enough
And
of.
can a blood test go to get a blood test?
Blood test can tell if it's that.
Take some of that.
If it's that problem, it will definitely a blood test can help out in that.
Right. All right, now you have that's for that heel.
Yes.
That shock thing.
Yes.
Let's move up a little bit.
Okay.
How about the ankle? Now, you know, the ankle is, well, I'll tell you, if you get a broken ankle or some kind of problem with the ankle because of the joint, you have to move it, you know, so what is
Well, the
advancement? What do you have
ankle
on
is
that?
probably one of the most complex joints of the body. People don't realize that. And I can explain to you that over the years, in fact, over the last 50 years, advances have been made in every joint in the body, this knee, the hip, shoulder. They've made artificial joints. The ankle has failed every artificial joint.
yeah?
You can't do it. It's too complicated.
Wait a minute, now, you get artificial what?
You can put new joints in the fingers. You can put them in the wrists, in your shoulder, in your hips, new knees. Very common.
Well, yeah, I got hip replacement.
You got a hip
Come to think of
replacement.
it. Yeah,
You got a
I
hip
got
replacement. There's none for the ankle. The
not the
engineers can't come up with one
Because it has so much
it's so
movement?
complicated. The movement inside that are so complicated they all fail. So consequently, see a lot of people have a lot of ankle problems. That's been probably my interest and my specialty over the past 10 years now. I get a great deal of patients sent to my office either through word of mouth or through their doctors with just recurrent or ankle pain that's just not going away. And
Now, what kind of pain would it be from the ankle? Is it
Well, you can
like
have,
when the movement
there's a
of the
lot of different
joint?
ways. You can have pain when you move it. In other words, you start to move the ankle and it hurts right away.
Okay.
You
Like
can
a sharp pain?
Like a sharp pain. One of the most common reasons that people live with ankle pain are people have been told for years they sprained their ankle. And they keep spraining them, and they say, "Well, you know what?
Yeah,
you got weak ligaments.
Yeah,
You keep spraining it. You're just going to keep spraining your ankle." It's false. We found.
Right.
You keep spraining your ankle, you create damage to the
Okay.
cartilage inside the joint. So people are told in the past, "You got to live with the ankle pain. You just keep spraining your
No.
ankle." Well, that's why we're not.
Yeah.
And one of the advances and one of the procedures that I've been utilizing a lot is arthroscopic surgery. You've heard of this with the knee, where they look inside
wait,
with the knee.
Say that again?
Arthroscopic surgery.
Okay, I can't bend them big words, you know. But this is something here, right?
Well, that's a picture of it or a
Yeah.
diagram of
Can you
it.
hold that up?
Yeah,
Maybe we can get a shot of it.
make sure this doesn't fall out of here. This is an example where you would look inside the ankle joint with, it looks like a little telescope,
Uh-huh.
about
Oh, okay.
2.7 millimeters wide. It's a telescope.
That's what telescopic, that means like,
Yes.
Yeah, okay.
Telescope. So this little telescope comes in, and what you're looking at then are pictures like this inside the ankle.
uh-huh,
So you're looking inside the ankle. This would be the joint itself,
okay.
and this is the cartilage. And then by looking at it and using other instruments through another little area, you can either determine that there's a tear in the cartilage, there's a bone chip, there's something loose moving around, a ligament problem. There's a lot of little things. You can actually see it. You can't see
Is
these
it
on X-ray.
a cloud of what shall I say,
Looks like
material
cotton.
there, what do you call it?
This is tissue. This looks like cotton.
Tissue, I meant to say, tissue.
It looks like cotton.
So do you have
sometimes.
something to suck it out?
Yes,
or?
I do. You use another instrument then. I see a picture of it. So, for example, another instrument comes in and has a shaver on it. Has a little device set up to a mechanical shaver. And what it does is rotates.
I just had that done on my Roto-Rooter. My sewer got clogged. And they
Yeah, it's
came
not
up,
that. It's like that. It's similar
yeah,
like
it
that.
cost
But
me
very,
$333.53 for
Well, I'm not
just like that.
well,
You
that
know.
works, but I'm not going to your sewer next time.
But that's the same thing. In other words, you go in there, you look, you see that thing, and then this other thing comes
in
over.
and shaves it out.
It sort of sucks it out, like
Sucks it out,
almost
takes
like
it
you do with a cataract. I get to suck
Yes,
out.
it's similar, same idea.
How about
Now,
that?
the advantage of this kind of surgery is that you're in and out the same day of the hospital. You go in,
No kidding.
go home, and when you're home,
This is the ankle.
ankle, and you're moving it right away. Now, this is done in the knee, in the shoulder, and the wrist also, but not a lot. There's been not a
No
lot
big
of people.
scar. You don't have to open it up or
No,
anything like that.
No, two small little incisions. Each incision has one stitch or one suture to close it. That's it. They come out in about 10 days, 2 Band-Aids, and you're back to
No
rehab.
kidding. Oh man, that's great.
So this has been a great positive thing looking at this.
Oh God. Well, now, is there anything else on the horizon or something that be helpful?
Well, a lot of things we look at, especially for diabetics, we're also
Okay.
into the medicine or science of prevention of problems.
Right,
Now,
prevention.
Prevention. One of the big class of patients that we see in my specialty are diabetics.
Okay.
And diabetics are notorious for having foot and ankle problems for a lot of reasons.
Like what? Now, why would a diabetic have an ankle problem?
Diabetes is, as you know, just a raising of the sugar, but
Right.
there's more to it than that. The complications as far as even from the eyes, from the heart,
Right.
from the kidneys, but what it does to the legs and the hands even is start to kill or cause a disease called neuropathy that destroys the small nerves.
Where the thing starts getting smaller or something?
And also it destroys the vessels or the arteries, so you get loss of blood flow.
Oh, okay.
So two things really are very important in diabetics. They may lose the blood flow to their feet, which then they hear that danger word gangrene, which every diabetic fears,
Yeah.
the darkening where they have to
Yeah.
have amputation. Or the other is what they call neuropathy, where the nerves literally stop working. They become numb. The patients walk, they could step on a nail and not even know it and go right through the
yeah.
foot. So a
Because
lot of
it's
it's
numb.
prevention, because it's numb.
And that's something.
So in prevention portion, this is what we're looking
Yeah,
for.
prevention now. You
So
know,
we're looking
something
at that.
to
So
prevent
how do
it.
we
We know we're
prevent?
talking about all the bad, what can happen, but how we prevent these
Well,
things.
if we're talking about from diabetic standpoint, it's a team approach. The patient has a good family doctor who recognizes the fact that their sugar has to be under control, has to be maintained at a certain level. They see their foot and ankle specialist every 2 to 3 months, do an examination. We make sure the nerves are okay. We check their pulses, make sure that there's no skin problems, and we try to pick it up early. If there's a problem that can be resolved early, then we prevent the major complications.
I have to throw this in here and say, do you ever, if you get a bad politician with his foot in his mouth? No, I would say that.
They all come in with their feet in their mouth. They all come in with their feet in their mouth.
You know, I was saying, before I put on this show, I said, I got to think of some kind of joke to lighten up, about a foot, So the only thing I can tell is a little story I used to tell my children, I'd say, that once upon a time there was 3 little kittens. One was named Foot, and then named Foot, okay? The 3 of them, one foot, and foot. So foot got sick. So foot took foot to the doctor. The doctor said, foot, and foot. I think foot's going to die. So next thing you know, foot died. So, they felt sad, So foot, went home. Next thing you know, foot gets sick. So foot took foot to the doctor. And the doctor says, he says, foot, I think foot's going to die. He says, he can't die. He already got one foot in the grave now. Oh, what a lousy joke. But I had to get that out.
You've been waiting for a long time to tell that, didn't you?
Huh?
You've been waiting a long time to tell that. It's the perfect time.
I had to get that off, right. But, a foot doctor, it's so important. Football players, baseball players,
Well, you brought up a good point, Hank, because, nowadays, if you notice, a lot of our children, our younger patients,
right.
play sports more so than ever before.
Right.
In fact, they play more organized sports than we ever did before.
Right.
I teach down at Temple University at the medical school there. And when I tell the students and some of the residents, I said, our pediatric population is changing in the fact that we're seeing more of them with foot and ankle problems.
Mm-hmm.
And it's simple. I tell them a story back when I can remember growing up in Norristown here. 4 seasons, we played 4 different sports. Every time the season changed, we changed.
Right.
For example, in the fall, we played football. In the winter, we played basketball. In the spring, we would get out and play baseball. Okay?
Right.
So it was always something different.
Soccer wasn't around then.
Soccer wasn't around.
No.
We had no soccer leagues. We
Now
really didn't know much
soccer.
about it. But that did something. Every change of seasons, when we would change sports, our joints and our muscles got changed into doing different movements, strengthening. The bones were different. The joints were moving differently. It's a little different now. A lot of our patients and the children play soccer 12 months a year. They play ice hockey 12 months a year.
Yeah.
Well, what do you think happens? They use the same muscles in the
Right.
same movement in the
Gotta
same
wear.
way, and it has to wear. So we're
Right.
seeing more injuries pediatric. In fact, it's become a subspecialty now, pediatric sports medicine,
Right.
because of these type of injuries.
My father and our whole family was shoemaker. We had a shoemaker shop on Main DeKalb Street, and we all worked in the shoemaker shop. I did more finishing. I never did the nails, and Hammer did the finishing, the trimming and all. But I remember my dad, people used to come in they wanted higher heels,
Yes.
And you take some of these women that are wearing these high heels, that's going to, my father used to say that it would hurt their back. Eventually, it's going to bother them.
That's usually
When you're out of, walking with them high shoes, it doesn't make sense.
Well, it didn't make
Something's
sense.
got to go, right?
Something's got to go. There's more pressure on the feet. That gives us good business. More high heels,
Yeah,
the better the business.
Well, okay, there goes money.
But seriously, there is definitely a change in the pressure on your feet, and I think there's been more a trend, especially with more business women who have to wear maybe a high heel to work. They'll switch to a lower shoe while they're in the office when they have when they have to travel back and forth.
Jim, I remember in the shoemaker shop, and the nurses at Montgomery Hospital, they would come in and they called a Cuban heel. It was comfortable, because the nurses had to be on their feet for long hours, and they had a comfortable shoe.
Yes.
So you can imagine somebody with these high heels walking, all day. Something's got to give.
And a lot of the shoes are made even for certain types of occupational.
How about these
things.
running shoes, the walking shoes, or running shoes?
Running shoes are important.
What's the scoop on that?
Well, running shoes are important. These shoe companies have evolved to such a degree where they've made shoes for each type of either sport, or there's a certain shoe for walking, there's a shoe for tennis. And believe it or not, that there's a lot of research and technology into those shoes. For example, a tennis player has to jump and move side to side, where the soles are made more cushioned in that area. And conversely, you wouldn't wear a tennis shoe just to do walking for 5-10 miles because it's not given enough support and cushion. So my best advice is if you're going to do a particular event, sport, or whatever it is, get the shoe that's really made for that. In today's day and age, the technology is there for it to be the best.
Now, you mentioned something about prevention. Like when we're sitting down, can we move your ankles? Tell me something about that.
That's always great.
Right.
It's been noted that maintaining your flexibility into your years, middle years, into old age, helps maintain health of not only yourself, the circulation, but also of the joints. I try to give descriptions to my patients. Bones and joints are almost like machine parts. If you don't move a machine part for a long time, it gets stiff.
Use it or you're going to lose it.
That's exactly right. That's a good sign. Use it or lose it.
Right.
That's a great.
Right. Well, Doctor, it's been great. I'll tell you.
Thank you.
I learned a lot. I got my joke out. I was able to do without messing up on that. So I really appreciate that, and I've had...
Well, I really appreciate asking me to come in.
Oh.
My hometown here. This has been a great experience.
That's great. You know, now your family's going to be watching this on TV now, right?
Yeah, now we have to do the second version in Italian now.
Oh, okay. All right. So, ladies and gentlemen, thank you very much for allowing us to come in. And I think maybe you picked up a couple little hints and what should I say, tips.
Tips
You
or
know,
some advice
because
for
every once in a while, Mother Nature gets lazy, and we got to help her out a little bit. So, until we meet again, God bless each and every one of you. Thank you very much. Okay, and thanks a lot. God, say, salute. Ready? Got the drink.